Hi, everyone. Goodness, it's stuck on my ear. Hi there. It's Wednesday, February 3rd. I'm Randy Murphy, Director of Disease Surveillance at the Mobile County Health Department. Just a couple of things to update you on today. So we had 146 cases of COVID-19 added yesterday in Mobile County residents. We added 3 more deaths, bringing the death toll to 632. 13 more hospitalized, so 4,215 hospitalized. And that daily number of people who are in the hospital dropped dramatically yesterday. It's still up around over 200, but many fewer people in the hospital with COVID this week compared to January and early February. Looks like it's getting a little bit better out there. So we're still at levels of cases and deaths and hospitalizations that far exceeded our previous peak, but it does appear that some things are leveling out a bit. So keep doing what you're doing out there to slow spread in the community. Wear your mask, wash your hands, stay at home if you're sick. All right, so a little bit on the vaccine front. So we had another successful vaccine event today at the event at 8 Mile Health Center on St. Stephen's Road. It gave out around 450 vaccines today. So good news for all the folks that were eligible and able to get vaccinated today. You know, we always have more people wanting vaccine than we have doses for. So, you know, supply is still critically low. We're getting vaccine out in what we believe is the best, fastest way possible. And as soon as we learn about new vaccine doses, then we will schedule events. So this week's events that we already have vaccine for, the ones left this week is tomorrow. So a drive-through event at Family Health Centronel. And then Saturday at our location for this one is in conjunction with our North Mobile Clinic, but it's going to be held at Belsaw Middle School at 1650 Gartman Circle in Mount Vernon. So just a little bit more detail about tomorrow's event. So again, we're looking at eligibility of 65 and over, first responders, healthcare workers, health-related occupations, clergy, government workers, corrections officers, and then workers in food and agricultural, postal service, manufacturing, grocery store, public transit, education, childcare, and judiciary. So again, the clinic will be a drive-through clinic, first come, first serve. We'll give away or give vaccine to those who show up first and are eligible. So bring proof of eligibility, your driver's license, or maybe your badge or business card. And again, it's the Family Health Centronel location at 19250 Mobile Street North in Centronel. For the drive-through to take place, it's going to take place on North Main Street. I'm told it's the road behind the clinic. So go online to mchdcares.com, where we have maps available to show you the traffic flow if you're planning to queue for this event. So again, we have a limited number of doses. Once we give them out, we won't have any more. So apologies if we have to turn anyone away tomorrow, which I'm sure that we will. But we're excited to provide this vaccine in the Centronel area. Remember, you need to have your ID, first come, first serve. You should defer vaccination if you have received any other vaccine in the prior 2 weeks. You also should defer vaccination if you have had convalescent plasma treatment or monoclonal antibody treatment for COVID in the last 90 days. So those are the only reasons that you might defer vaccination, and we will check those things with you before we put a shot in your arm. So again, be prepared to wait. Sometimes a queue develops. We usually get those cleared out really quickly, and we generally can give 400 or 500 doses in just a matter of hours at these locations. So that's really good news, but appreciate your continued patience and cooperation as we are doing the best we can get vaccine out in the community as it's allocated to us by the health department. All right, a couple of questions that I can try to answer today. Someone asking about vaccine spoilage or vaccine doses that have had to be thrown away. MCHD has not had this situation. We have been able to give all of our doses. Sometimes that requires us jumping in a car and running to a hospital or a healthcare facility where other people, that qualify are there, and we can put it in their arm. But for the most part, we're getting to be pretty good at being able to manage it so that we give exactly the number of doses that we have allotted, and actually a few more. So we're usually able to get 11 complete doses out of a vial that that is said to contain 10, and that's not just Mobile County. That's nationwide. We're seeing that. So no vaccine spoilage that I know of. No vaccines had to be thrown away that I know of. That's really good news. So kudos to the nurses and pharmacists around town that are drawing up those vaccines out of those multi-dose vials and handling the patient flow to make sure that we don't waste doses. All right, someone asking if we're concerned about crowds on Fat Tuesday and it becoming a super spreader event. So any gathering concerns me. We are still under a safer at home order, which means masks are required. Non-work gatherings are prohibited unless you can maintain a 6-foot physical distance between different families. So any event that cannot comply with the safer at home order and those conditions is at risk for becoming a super spreader event. Any gathering, whether it be on Fat Tuesday or Martin Luther King Day or Christmas or the basketball game or the wrestling tournament or an arts and crafts event, any gathering is prohibited that cannot ensure that people are 6 feet away from anyone who does not live in the same house as they do. And yes, it is concerning, but it's not just the Fat Tuesday plans. It's also lots of other things that we hear about going on in the community. All right. Another one, someone asking about, I had mentioned that the state is planning sort of a push of vaccine next week. The details of that are still being worked out. I don't have any more details on that. I'm sure as soon as ADPH works that out across the state, they will push that news release to the public. I only know that they're trying to do at least 5,000 extra doses in 8 locations around the state. And also, is it important to get vaccine into arms? Yes, it's important to get vaccine in as many arms as we possibly can, as to begin working towards what we all want to happen, which is enough immunity in our community to slow the spread of COVID transmission. It will take many months before we get there. And particularly with some of the new strains that are circulating, that we will need even a higher percentage of the population protected. Originally, it was thought around 70%. If around 70% of the population got the vaccine and had immunity, that we might hit that herd immunity level, which we need to help slow transmission. Last time I did some calculations, it looked like only about 7% of Mobile County population had actually gotten at least 1 dose of vaccine. So we are a long way. So yes, it is important that the state and the county get as many vaccines in arms as possible. And we're very grateful for our healthcare partners and our association partners, our emergency management agency partners, and ADPH for helping us get what we need for Mobile County residents, and that is vaccine. So I will end there today, and we'll give an update tomorrow about how tomorrow's clinic goes and provide some additional detail about the clinic that's planned for Saturday. So have a great evening, everyone.